freedom of choice, the evergreen state is ever vigilant in protecting this freedom right. This is a freedom from intrusion by any politician or any government in the most intimate private decision by a woman in the state of Washington. And we know, unfortunately, there are states across the country that are and will be attempting to put its tentacles into the state of Washington. We will not allow that. We know there are threats from some judicial decisions to threaten that right. We will not allow that. And today we will be taking not one but multiple steps to protect this freedom of choice. We are proactively protecting patients. And I say patients advisedly. Freedom of choice is a health care issue. We are protecting access to health care for the women of the state of Washington. And places like Idaho and Texas are attempting to prevent travel, to violate a woman's right of travel, and to try to use our judicial process in the intrusion of this health care right. So let's talk about the multiple ways we will be protecting a woman's right. First, we are protecting a woman's right of access to mifepristone. This is a pharmaceutical that for decades now has been used safely and effectively, and is the majority of abortions today. It's used in this safe and effective manner. And we will not sit idly by while Trump-appointed judges attempt to deny women's access to this safe and effective product in the state of Washington. That's why I am proud to say Washington State acted with foresight to get access to 40,000 doses of mifepristone, and by this act today, we are going to make sure that the women of Washington State have access to this drug. And I'm proud that the Washington State has led the nation in doing this. Other states are now joining us in following this in this regard. And I think it's appropriate that Washington State lead on this, because we were the first state that by public vote protected a woman's right of choice in the United States. And we again are leading the state in this strategy to protect this freedom right. We are also protecting this right from intrusion of other states trying to use our judicial system against this freedom right. And I'll be signing HB 1469, which will shield women of the state of Washington, shield them from the intrusion of other states that somehow would try to use our judicial system against this freedom right. This bill will prohibit cooperation for our state's investigations relating to abortion, and it will prohibit methods to try to intrude into this right across the state of Washington. Further, HB 1340 will protect health providers from having their licenses revoked or other disciplinary actions stemming from reproductive care or gender-affirming care. And by the way, this is an important issue. Idaho is losing some of its health care providers because they've attempted to deny the travel rights across our borders. Let me say this, those providers are welcome to come and practice in the state of Washington. We will welcome them to the state of Washington. We are also protecting women from violations of their privacy regarding their private data. We're going to make sure that we do not allow the abuse of private health care data to be used by other states or others who are attempting to violate these privacy rights. This is an effective tool, and I'm glad that we're thinking ahead in this regard. We're also be signing Senate Bill 5242. This will eliminate deductibles for insurance cost sharing for abortions. This will protect patients from unexpected expenses associated with this right. Now, I am glad that the state of Washington has acted with so many leaders who have stood up, many of whom are here today. The people who've been with me today are pretty in pink, even our Attorney General. I hope he's wearing a pink tie. Oh, he wears a pink tie. After I sign this bill, After I sign this bill, I will be lending him my extra pink tie for our next one. But we have had a terrific champion for our legal rights, including the rights of freedom of choice, who has now won about 40 out of 41, and he's going to be continuing this win streak to protect the rights of women. Bob Ferguson, come on up, Bob. I'll get you a tie.
Thanks so much, Governor. I know my first agency request legislation next session is to make sure that anytime it's a sunny day like this, every gubernatorial bill signing must be outside. I think that's what we're doing next. But thank you, Governor, and Trudy Inslee and the University of Washington for arranging this really wonderful bill signing here today with so many champions for reproductive freedom. I'll be brief. There's a lot of speakers, but I do want to touch on briefly a key bill that's being signed today. It's the My Health, My Data bill. I was proud to propose as agency request legislation, and even more proud to work with a couple true champions in the legislature for reproductive freedoms. You'll be hearing from them, Senator Dingra and Representative Slatter, who were, just really were tremendous champions to move this through on the session that we just concluded. It's been interesting working on this legislation because it's one of those bills where, as you work on it and talk about the issue, people realize, wait a second, I didn't realize my personal information wasn't protected. So just give you one example. Of course, if you go to a hospital, HIPAA protects your information, right? If you go there, your information cannot be released, of course, by the hospital. We all know that. We all understand that. At least speaking for myself, I kind of take that for granted. What I think a lot of people did not realize is, like, let's say you, for example, use an app to track your period. You might quite reasonably think that your very personal health information is being protected. No HIPAA applies in that setting. The entity that owns that app can literally give that information away, can sell that information without your consent, which is outrageous. And as you mentioned, Governor, in the times that we live in now, with so many states who seek to reach their tentacles into our state and take away the right of reproductive freedom, to criminalize and seek civil sanctions against individuals who seek that right, it's more important ever to make sure that that personal health information is protected, and that is what this bill does. It also has one more thing I'll add that's very important in privacy laws, but very rare around the country, and why I'm so appreciative of the legislature this year, is the fact that not only can the AG's office enforce this, but it has what we call a private right of action. And what that means is an individual can assert their rights against a company that violates this law. So there's extra protections in place that we think are so important. Lastly, I do want to say my legislative team did fantastic work this session in general on a lot of bills that we've been proud to work with the governor and many legislators here. But they did especially good job on this bill. Joyce Bruce is here, who leads my team. Andrea Allegret is here, and many others. They did a wonderful job, and I'm confident we can all agree we wouldn't be at this place without their tremendous help over the course of this session. So it's an honor to work on this legislation. I so appreciate living in a state where we have a governor and a first lady who this is a priority, and have legislative leaders, and most importantly, grassroots supporters who are well represented here from all kinds of organizations. I spoke at a meeting earlier this year. I was speaking about this bill, Governor, and at that gathering, they literally had during the event, everybody get your phones out and write to your legislators during the event. It was literally that type of thing, and that grassroots support from so many are here. For all of you, we really appreciate your support to just hold all of us, our feet to the fire, to pass all this important legislation. And with that, next up is someone who is a prime sponsor of this legislation, Representative Slatter, who's a true champion. Representative.
Thank you so much, Attorney General Ferguson. I actually was told that there were birds that might be here today, that they might share some gifts with us, so that's the color I wore. But I absolutely am pink inside. As a pharmacist who's fought for reproductive health access, as a mom and as a woman, to stand here is deeply meaningful. In this post-Dobbs age, when 50 years of the right to privacy, bodily autonomy, and access to abortion has been reversed, Washington is advancing protections and sustaining hope for future generations. The Washington My Health, My Data Act will protect our sensitive health data online. As a healthcare professional, under the federal HIPAA law, I can be fined, lose my license, or go to jail for sharing the same personal health data that is routinely being shared online by companies and sold. This bill closes that gap, ensuring our right to make private health care decisions and protect those who are coming into our state seeking reproductive health care and gender-affirming care. I want to thank Governor Inslee and First Lady Trudy Inslee for your steadfast support, to Attorney General Ferguson and your amazing team for all of your hard work, to Senator Dhingra for your dedication and partnership, to Representatives Hansen and Representative Street, and to all my colleagues who are here who voted for and supported this legislation. And my immense gratitude to all the moms, grandmas, wives, sisters, dads, students, doctors, nurses, tech workers, and all the people who reminded us every day why this matters. Because of you, because of all of you, the signing of HB 1155 today will allow people in our state to say, my health, my data, my choice. Thank you. And now, it is my great honor to invite Senator Monica Dhingra to give some remarks.
Good morning, everyone. When we talk about healthcare privacy, we're basically talking about informed consent. People need to know when sensitive health data is being collected, used to make inferences about health status, and being sold. Healthcare has clearly entered the 21st century. When we need information, when we want to do research, where do we go? We go online. More and more people are using period tracking apps, social media, and online resources for health information. Those new resources can provide a great benefit. However, they can come at a great cost to the individual. And that's why it's long past time that privacy protections enter the 21st century as well. People have a right to know what happens to their sensitive consumer health data, especially reproductive health care and gender-affirming care, and they have a right to ask that that information be deleted. In testimony, we heard about how a location data broker sold the aggregated location data of people who visited abortion clinics, including more than 600 Planned Parenthood clinics, for just $160. That's all it took. The data showed where patients traveled from, how much time they spent at the healthcare centers, and where they went afterwards. This kind of information is all too easy to connect to individuals, and it's all too dangerous when bad actors get their hands on it. The My Health, My Data Act will be a national model for protecting the right of privacy that all of us expect and deserve. People have a right to know what is being done with their information and have a right not to have it used nefariously. Legislation doesn't pass in a vacuum. It passes because the community demands it. And I'm so grateful for so many Washingtonians who demanded that Washington State act, and I'm so proud to be at this bill signing today. And with that, I'm going to introduce Representative Drew Hansen.
Great job, great job. All right, how y'all doing? Good to see you today. It's wonderful to be here today. We would prefer we didn't have to be here today. We would prefer it if Roe versus Wade was still the law. But where the Supreme Court is not going to protect reproductive freedom in America, Washington State will protect reproductive freedom in Washington State. That's what these bills are about. Every single bill that my constituent, the chief executive, is signing today is going to take significant steps to protect reproductive freedoms in Washington State because of the United States Supreme Court's abdication of its responsibility. My bill is the SHIELD law. My bill says that states like Texas will not be able to use Washington State courts or Washington State judicial process to enforce their anti-abortion laws. Texas can do what Texas wants with Texas law enforcement, Texas courts, and Texas judges. Under the SHIELD law, Texas cannot use Washington State courts, law enforcement, and judges to enforce its anti-abortion laws. We are very happy that the governor, the Attorney General, and a broad and diverse group of legislators, activists, and advocates are standing united to say loudly that we will continue to protect reproductive freedoms in Washington State. Again, we wish we didn't have to be here, but when we do have to be here, we will act swiftly and aggressively to protect reproductive freedom. So with that, let me give it up to Senator Karen Kaiser. Yay!
Who'd have guessed we would have been here a year ago? When the Supreme Court reversed Roe v. Wade, many of my colleagues here, many of the advocates here started seeing, what do we do now? Where do we go next? And I want to congratulate all of my colleagues and advocates and the governor and the Attorney General for showing initiative and showing creativity and taking action. And what we did when we passed Senate Bill 5768 was really unique. We had the state purchase the abortion pill, mifepristone. By having the state make sure we had a stockpile of the abortion pill for people who need it, and that's about 10,000 women a year in our state, and more if people come from other states, we are able to guarantee access. It's one thing to have a right, but unless you have access, you don't really have a right to do what you need to do for your own health and your own future. The volatile situation we have in our courts right now, where we don't know from day to day whether the stay is going to stay or going to be lifted, or a new rule is going to be impacted, or some other judge is going to reverse another FDA-approved drug that helps women and women's health. We are in such a volatile situation that states have to act to protect their own residents and as many people as who come to our safe haven for abortion care. And that's what we did. Wait times are longer than they should be, but we are doing what we can to make sure access is available to anybody who needs it. It's 60% of our abortions are achieved through medication. And we need to make sure that those mifepristone pills are available, and we are doing that with the enacting of Senate Bill 5768. And once again, I have to thank all of the advocates, all of my colleagues, the governor and the Attorney General. We couldn't have done all of these bills without all of us working together in concert. Now I'd like to turn it over to the House Healthcare Chair, Representative Marcus Riccelli.
Well, thank you. It's great to be here. I left my house at 3:45 in the morning. I brought the sun with me from Eastern Washington, and the sun is certainly shining on all of Washington today. First, I wanted to say a few words on behalf of Senator Cleveland and Representative Bateman on 5242, which allows for greater access by eliminating any costs consumers have to pay for abortion services. Cost should not be a factor that people seeking abortion care should have to face. We need to ensure affordability and access, especially for individuals who have financial barriers that impede their ability to get these services. I'm very proud that our state is leading the way in expanding access and affordability for all aspects of healthcare, especially reproductive healthcare. So thanks to them for their leadership in the work on that bill particularly. I also want to speak briefly on the bill that I sponsored, House Bill 1340. We know there's new uncertainties out there with the Dobbs decision, and this legislation will ensure provider protections exist as we navigate through them. We know that in Washington, it's legal to provide the full range of reproductive health care services, including abortion and access to gender-affirming care. And our providers should continue to do that without concerns or fear that doing so could put their medical license in peril. As someone who represents a district east of the Cascades and that nears the border of Idaho State, where their governor and legislature is looking to criminalize access to health care and essential services, this is incredibly important. And let's not forget just a panhandle over in Montana where their legislature is looking to silence representatives for speaking out on behalf of all the people and the services that they deserve. This is incredibly important to my district and someone from Eastern Washington. This is incredibly important to our state. So this will help ensure Washington remains a place where access to essential health care is vigorously protected and safe, and is a safe haven for access to abortion for our healthcare professionals, as well as the patients they serve in accordance with our Washington state laws. I couldn't be more proud to be standing here with these legislators and all these folks who helped bring this to fruition. And with that, let's get to the important part. It's my honor to turn it over to our governor to put these into action. All right.
Thanks for getting up this morning.
Excuse me, I'm so sorry. Just moving this over here. Thank you. Pardon me.
Before I address these individual bills, I want to make a comment on this legislative session and what was achieved. After I sign these bills, no state in the United States will be more protected, more vigilant, and more successful in protecting women's right of choice than the state of Washington. And I think we owe a debt of gratitude to these legislators to being creative, persistent, and successful. Those who are not legislators, can you give them a round of applause for what they achieved, which I appreciate. Thank you. We're going to start with House Bill 1155. This prohibits apps, websites, and other non-health care facilities from collecting, sharing, and selling someone's health data. Called the Washington My Health, My Data Act, this bill addresses gaps that have allowed organizations to take advantage of consumers seeking reproductive or gender-affirming care. It also makes it possible for individuals to sue for damages when their privacy is unknowingly breached. The Attorney General's office requested this bill. Thanks, Representative Slatter and the companion bill, Senator Dinger. I'm signing this bill. Thank you. We'll sign for a second. All right. How you doing? I'm going to get. Here we go. Here we go. And I dotted it with that.
Thank you, Governor.
Okay.
Thank you so much.
Thank you.
Richelli. Richelli's next. Okay. Come on in.
Put the 6'4" guy up.
Okay, ready? Okay, we're for House Bill 1340. This bill strengthens protections for healthcare providers who offer abortion or gender-affirming care to their patients. This means healthcare providers who provide services to people in Washington will not experience licensing or disciplinary action brought by another state where those services are not legal. These extra protections for providers will ensure that they feel safe continuing to practice in Washington, which maintains strong access to these services for patients. I want to thank Senator Richelli for getting up at 3 o'clock this morning. It shows you he's always alert. And this bill, I think, is indicative of how thoughtful these legislators have been to look for every single way we can to protect this right. Also, Senator Solomon, my lentai, I'm signing this bill. Happy to do so. Okay, let's smile for a second. Okay.
All right.
Thank you. Thank you. Okay.
Hanson.
Okay, next up, House Bill 1469 strengthens legal protections for patients who receive and providers who assist in reproductive and gender-affirming care in Washington. Other states may take and are taking draconian steps that attempt to punish people who are providing aid to people receiving abortions and gender-affirming care, but we will not stand for that in Washington State. Other states will not get access to witness and information they would use to persecute someone for providing a legal abortion in the state of Washington. This bill, known as a SHIELD law, will protect those who provide and receive legal services in the state of Washington. I want to thank my representative, Representative Hanson, and thanks to the companion bill, Senator Trudeau, happy to sign this bill. This is also known as Keep Texas's Tentacles Out of the State of Washington bill. So let's smile for a second there. All right.
All right.
There's my guy.
Great job,
Good job.
constituent.
Good job.
Appreciate that.
Good job.
Good work.
Thank you.
Get out of here. Good job, dude.
This is Senate Bill 5242. It requires health plans, including our public and school employee plans, to eliminate the amount the insured individual would pay for abortion services. This bill makes abortion coverage more affordable and accessible while strengthening our fundamental right in Washington to abortion access. Thank the prime sponsor, Senator Cleveland, and Representative Bateman to get this bill to my desk. Happy to sign it. Okay, let's smile for a second. Okay, we got somebody can deliver. I didn't
can
see
take it to
you
Vancouver
can. There,
for you.
there goes to Vancouver.
I'll be there in a few hours. Personally delivered.
Okay, here we go. Senate Bill 5768. This allows the Department of Corrections to distribute mifepristone to reproductive health care clinics. We recently took unprecedented action to stockpile a 3-year supply of this pharmaceutical. Given the chilling legal uncertainty the nation faces on this issue, we are proud of the bold actions we took to ensure that people seeking an abortion will continue to have access to this safe, and I repeat, safe and effective product that has been used safely and effectively now for 2 decades. It will continue to have access in our state to the safest and most effective care, especially when they exercise their fundamental right to seek the reproductive care that's right for them. Now, I want to comment on something. When we learned what the Trump judges were up to here, I did not hesitate to act. I acted under my emergency and executive authority. It was fully compliant with Washington state law. It is regrettable that the Republicans have criticized that act, but it was absolutely necessary to do so. And this has now been confirmed by the vote of the Washington state legislature. And there's an aspect of this that has not been adequately reported. I want to share with you. We cannot predict what the Supreme Court will do in the Texas decision. We cannot predict it. But what I can tell you is this: no matter what the U.S. Supreme Court does in this regard, under our laws and under the United States Constitution, that decision will not affect our access to mifepristone because of the action I have taken. We have this product in hand. It can be legally distributed under our state law. Nothing the Supreme Court do will allow the Republicans to stop women from having access to mifepristone. I'm glad we have taken this action. So with that, I'm happy to I want to thank sponsor Senator Kaiser for her foresight. She jumped right into this issue with us, and Representative Bateman. And I just want to know, I want to explain why we are certain of this, and this may sound a little unusual. Under our state law, we have the right to make decisions about dispensing these products, even if the FDA, to somehow under a Trump judge, does not give us approval. The combination of our state law and the relationship to federal law gives us the right to do that. So I want to tell people that even if you're worried about Trump-appointed judges, and you should be, you will be able to have access to this product in the state of Washington. With that, I'm signing this bill. I'm glad we've taken action in the state of Washington. All right. All right. Where's Karen? There you are. Good job.
Thank you.
With that, we're going to step over here, and if there's any questions, and if anybody would like to answer questions, join me over there. Let's just stand up. We'll go over and talk to those who want to protect the First Amendment and democracy.
Leaving things